Welcome back. For millions of people suffering from fibromyalgia pain, each day can be a struggle. It's a debilitating disease that causes extreme fatigue and pain, and most people are not fully diagnosed until years after those initial symptoms start. Dr. Ashraf Hanna from the Florida Spine Institute joins us today, along with his patient, Catherine Barber, who's had success with one of his big treatments. Thank you guys both for joining us today.
Thank you.
First, let's start off with fibromyalgia itself. It's something that's a little bit hard to diagnose, and then some of these treatment options.
Yes, well, fibromyalgia affects really, as you said, millions of people worldwide. Usually patients will complain of diffuse muscle ache, tiredness, fatigue, abdominal pain, joint pain. And then it's usually, a problem is that it's a diagnosis of exclusions. So patients will have all their tests done and then they're told it's all normal. All the tests are normal. So patients get frustrated, the doctors get frustrated, and at the end they're telling them everything is okay, it's in your head.
Oh, I mean, I've heard that. I had a boss that I worked with, and they told her for many years that she had depression. And it turns out later on it was actually fibromyalgia all that time.
Yes, so I mean, what we used to believe that was a muscular disease, now we believe it's actually in the head.
Okay.
It is in the brain. It is a neuroinflammation of the brain. And then the brain releases some toxic chemicals that travels through the nervous system to all the internal organs, all the organs in the body, the outside, the muscle, the skin, and causes actually a kind of a neuropathy.
Okay.
That's what we call small fiber neuropathy. And the good news is we were actually able to diagnose that on skin biopsy. So it's actually a true disease now.
So you actually, and you can get your diagnosis early. Let's talk about some of the what are the normal, or what are the average treatment options?
Well, treatment options for fibromyalgia usually range between physical therapy, psychotherapy, medication management. As far as medication management, now with the new information about the pathology and etiology of fibromyalgia has changed. In the past, we used to give anti-inflammatories, muscle relaxants, even occasionally opioid or narcotics. Now we have changed that drastically. You know, actually opioid or narcotics can cause increase in the pain of fibromyalgia. Our treatment now mainly is to treat the brain. So we use a lot of antidepressants, anti-seizure medications with good success. We use a lot of natural products like alpha-lipoic acids, magnesium, vitamin C, turmeric. Also, we're starting to use a medication called low-dose naltrexone, which works on the brain for inflammation as well. And then, of course, lately, the new treatment with the IV ketamine therapy with excellent results.
All right, let's jump to Catherine just for a second, too, because you've been a patient of Dr. Hanna's. And as president of a large corporation, I can't even begin to imagine how something like fibromyalgia can affect your life, your career, everything, right?
Yeah, Stephanie. I suffered from widespread muscle pain and just fatigue, and it was a progressive situation for me over the course of 25 years. As an executive, and finally in 2007 I was diagnosed with fibromyalgia. So the mystery was solved.
Finally, you get this diagnosis. What a huge sense of relief.
By that point, unfortunately, I had become bedridden and had no functional life whatsoever. I did have pain medication to manage the pain. However, that didn't solve the underlying condition. Finally, in 2014, I began IV ketamine treatment with Florida Spine Institute and Dr. Hanna here in Clearwater, Florida. And I'm so happy to be here today.
I can sense it from you right there.
Because it's virtually eliminated my fibromyalgia pain.
Okay.
As well as eliminated the need for any pain medication. I was one of those patients who was on pain medication, and it really masked it to some extent, but I was bedridden.
Right.
Now what I have is a quality of life and energy to do so many of the things I wasn't able to do.
So tell me, what is the IV ketamine treatment? What is it and how does it work?
Okay, well, there are several studies in Europe now that were done about IV ketamine therapy for fibromyalgia. And we're actually conducting a study now at our center at the Florida Spine Institute about that as well. It simply blocks the receptors in the brain that cause the release of a lot of those chemicals that cause all this pathology that happens in the nerve cells. And what's unique in what we do is we incorporate that with physical therapy and psychotherapy. So we don't only get good pain relief, but we also are looking for improvement of the function in the whole body. Our goal is to get the patients from being disabled to functional and back in the workforce. And what was really special about Catherine is that, which we're going to publish her case, is that there is nothing in the literature about any patient with fibromyalgia who got over a year of relief from any treatment modality whatsoever.
It is amazing.
I'm going
So
on
very
15
good things,
months, yeah.
Very good things happening. Thank you for sharing your story, and thanks for sharing more information with that about us. You can find more information online as well. There's the phone number to call, and there are the websites to get a hold of as well. We are going to be back to wrap things up right after this with more music from Justin Grimes next.